Hello, how are you doing? I'm Chris,
Very
I'm a
well.
student physical therapist for today.
Okay.
Today we're just doing a gross muscle testing and range of motion. So we're going to be moving you through some ranges and applying some resistance to test your muscles.
Okay.
Okay, so the first thing I want you to do is lift your right knee all the way up.
Okay.
And press on. You can have your hands back for support.
Mm-hmm.
Lift your left leg all the way up, hands down. So I'm going to pull you up. Just don't let me pull you.
Okay.
Pull the other side. Don't pull you. And lift up that right side just a little bit, just a little bit. Just put it down a little bit. There you go. Other side. Good. So now I want you to, don't let me push you in, okay? Mm-hmm. Knees together. Don't let me pull you out.
Okay.
Good. So now I want you to extend the left leg all the way up and put a slight bend to it. Don't let me push you down. Here, same thing, all the way out, slight bend. Don't let me push you down. Good. Now I want you to bring your heels towards the butt or towards the back.
Okay.
Now just relax. Now don't let me pull you. Okay.
Okay.
Same thing, don't let me pull you. Good. So now I want you to draw your foot almost up to your shin, like that. So I want you to keep the hip on the ground, okay? Okay. So don't let me move you. Other side, same thing. Don't let me move you. Now I want you to go out. Try to keep the hip down. Okay, good. Don't let me move you. The side, don't let me move you. Good. I want you to point the toes all the way up. Don't let me push you down. Don't let me push you down. Point the toes all the way down. Don't let me pull you up. Don't let me pull you up. So now I want you to put your point the toes together in. Good. Don't let me move you. Don't let me move you. Now I want pinky toes out like that. Don't let me move you. Don't let me move you. So I want you to have the toes come up. Don't let me push you down. Okay? Same thing. Don't let me push you down. Good. Press the toes
Overall,
together.
she
Don't let
scored
me pull
4s
them
and
up.
5s with no major strength deficits.
Don't let me pull them up. I want you to spread your toes out wide and don't let me push them together, okay? Okay, good, thank you.
Mm-hmm.
Yeah. Okay, now we're gonna be doing hip flexion in an active state.
The center fulcrum is going to be the greater trochanter. The proximal arm is going to be with the lateral midline of the pelvis, and the distal arm is going to be in line with the lateral midline of the femur, using the lateral epicondyle as a reference.
Zoom in here on the starting point. All right, so now I want to ask the patient to bring her hip all the way up as far as she can towards the chest. Okay. And there you go. She's 125. Great.
Normal range for hip flexion is between 120 and 140 degrees.
So now I'm going to be measuring hip adduction passively. So I'm going to be palpating for several landmarks again. First thing I'm going to palpate for, is it okay if I palpate?
Yes.
Are your both ASIS. So they're important for two measurements. So one's going to be the center fulcrum, and you want the proximal arm to be in line with both ASIS. And the distal arm will be in line with the midline of the femur. So I'm going to be measuring the right leg. So I'm going to have you bring this leg out, right? And I'm going to move her leg passively over to the left side, okay? So I'm going to move that leg first.
For this measurement, I got exactly 20 degrees. So for hip adduction, its normal range is 20 to 25 degrees.
Good. Okay, so now we're going to be measuring the ankle, and first off, we're going to be measuring dorsiflexion in an active state. So I'm going to be having the center fulcrum on the lateral malleolus, the proximal arm in line with the fibular head, and the distal arm in line with the fifth metatarsal. So we're going to start So I'm gonna have, let me get further down over here. So I'm gonna have the, like I said, the center fulcrum and lateral malleolus, and the proximal arm in line with the fibular head. And then I'm gonna have you bring your ankle up, line with the fifth metatarsal. So let me see here. Just in line. Okay, so it's about, you bring it down just a little bit. Up just a little bit. Okay, good. So now I want you to bring your toes as far up as you can. Bring up the ankle. Good. Okay. Good. So I got about 22 degrees of dorsiflexion. So now I'm going to be measuring plantar flexion passively. So the landmarks are going to be the same as the dorsiflexion. So the fulcrum is going to be on the lateral malleolus, and I'm going to have the proximal arm in line with that fibular head, and the distal is going to be in line with the fifth metatarsal. So I want to start at 90 again. So go ahead and start at 90. Good. So now I'm going to move your foot down, okay? And as much as you can, and I'm gonna realign everything, make sure everything's in line. Okay. Good, good, good. A little bit further. Good, I got 57. So next we're going to be doing muscle testing for the glute med. So we're going to have her lie on her right side, testing the left side. So you're going to have her lower leg or lower hip flexed for some support. And I'm going to have her leg, her hip extended. Apply one hand here for some support. I'm going to apply resistance near at the ankle. And I'm going to press down, resist for 5 seconds. Good, and so since she was able to resist at the near and distally, she is a 5. Okay, so now we'll be doing testing the anterior tib for muscle testing. So I'm going to ask the patient to bring her foot up and toe in. So I'm going to apply some resistance, and since she breaks, she's not able to accept any resistance, but she's able to hold that position, so she's a 3 out of 5. All right, so now we're going to be doing knee flexion manual muscle testing. So I'm going to have her prone. So I'm going to have her, are you able to bring your leg to 90? So bring your heel closer. Oh, okay, so it looks like she's not able to do that. It's going to have you lay on your left side for me, please. Okay, so this is a testing, since she can't go against gravity, doing a gravity minimized position. So I'm going to support her leg and ask you to bring your heel closer to your butt. Okay, and I am not applying any, are you able to go a little further? Okay. I'm not applying any resistance, so she is not a 2+. So now we're going to be doing the muscle length test, starting with the Eli test, which is measuring the length of the rectus femoris. So I'm going to have one hand here for support. I'm going to flex her knee up. So I'm going to be looking to see if there's any movement of the hip. If we get to 90 without any movement, that means it's a negative test. If there's any movement before we get to 90 degrees, that'll be a positive Eli test, but she's negative. Good. So now we're going to be doing the distal hamstring length test for the semi-tendinosus, semi-membranosus, and bicep femoris. It's going to have her in supine. So I'm going to have her knee, or have her hip flexed, and I'm going to, with the leg still, I'm going to extend her lower leg out. And so we want to get to, at least for females, 152. For males, 141. And she looks like she's well past 152, so that is a negative.
I approve of Chris's video.